We're going to spend some time now speaking to someone who is living through this water crisis. Dr. Holden Sheffield is with us this morning. He lives in Iqaluit. He's also chief of pediatrics at Qikiqtani General Hospital. Dr. Sheffield, pleasure to meet you and thank you for being on our program today.
Thank you for having me.
The mayor has said every part of the town is affected by this water issue. Dr. Sheffield, I'm wondering, when you turned on your taps, did you notice anything at all?
Yeah, we personally don't have any fuel-like odor coming from our taps, but I have heard from a lot of people, both friends and various people around town, that they had a fuel odor coming from their taps, for sure.
But now they've said nobody should drink it whatsoever, wherever you are. So you stopped drinking yours. Where are you getting water now?
Yeah, absolutely. So we've stopped drinking ours. There's what's happened in terms of where you can collect water is there's been trucks that have gotten water from the river that then has been chlorinated, and then there's been fill stations where we've gone and brought in jugs and vessels over to these fill stations to then be able to bring back home. As you've also reported to, some 80,000 liters flew up as well, so they have been handing that out to the public as well in order to bring home.
We're looking, as you speak, Dr. Sheffield, we're looking at those images of people at the river and then lined up to get those first shipments that came off the plane yesterday. Pretty extraordinary scenes. What are you hearing from people, the community of 8,000 people talking about this? Obviously, what a crisis for everyone. What are you seeing as people have to look to these, pretty unusual circumstances to get water to drink?
Yeah, for sure. Overall situation is obviously concerning in general, of course. And I think, what's most important at this time as well is that we, from a community perspective, ensuring that the most vulnerable are taken care of. So those who are having difficulty actually accessing and obtaining the water. I have to say I've seen a lot of social media involvement on websites like Facebook, trying to ensure that those who are having difficulty getting water have people who can help, pick up water and bring it to them, which has been really great to see. And I know that the city had set up a hotline to contact for those who need a little bit more assistance and help, because certainly that can be a real big challenge for sure.
Well, it sounds like you think the community response has been pretty strong, if I'm interpreting properly, but you're right. People who are vulnerable, one of my regular viewers wrote to me, and it was $43 just to get a few small bottles of water for her and her dogs who needed waters too. I mean, the cost is extraordinary, and you've written about that. I noticed on your tweet talking about the cost of water right now is really exposing so many challenges in Nunavut. What's your take on that?
Yeah, absolutely. So, there's obviously been a lot of national media attention around this particular episode of a water crisis in Iqaluit. But, certainly this is not something new in many ways. So, in terms of access, what this has highlighted, I know the mayor was on CBC a couple days ago where it was pointed out that a liter of water is about $9. That's not anything new here. Food is extremely expensive. Cost of living is extremely expensive up here. And when you look at 56% rate of food insecurity within the territory, I think that goes hand in hand with the overall cost of living up here. So I think it's important to recognize with, national media attention that on this particular incident and water crisis, that this is not something that's, necessarily new. When you look at the number of boil water advisories that happen across Inuit communities, I believe there's somewhere around 300 between 2015 and 2020 within Inuit communities. There's obviously bigger issues at hand related to infrastructure, and this is not an isolated incident.
No. I noticed on your tweet that you directed it at the federal party leaders. So are you one of the people, we were just hearing in that report someone saying that this is perhaps a crisis that is drawing attention to these long-standing issues and may indeed speed up a response to them. Are you optimistic at all that something good could come from this critical moment?
Yeah, absolutely. I mean, I think when you're in these types of crisis events, I think that's what you need to do is you need to be able to obviously do what you can to make things better. And for me, that's through advocacy. And so that's where sort of sending out a message to federal leaders to first raise awareness, I think, of the situation. First and foremost is first step, and then hoping for action to look at obviously this particular incident and event, but also the bigger picture here and how we can hopefully prevent these events from happening in the future.
Right. I'd be remiss if I didn't ask a pediatrician about some of the medical components to this. Now, just so everyone knows, we don't know yet what exactly has been in the water. That's at a lab right now, and the results are expected back in a couple of days, so we shouldn't probably speculate as to health concerns from all of this. But I'm wondering if at the hospital, in your practice, pregnant women and infants are being told not even to bathe in this water. That's the level of concern. So are you seeing any parents or children who are concerned about this?
Yeah, no, haven't seen anyone personally in regards to this. Haven't heard of anybody coming in with any acute illnesses. But as you said, exactly, I think we're just waiting for more information right now at the time to figure out exactly what this might be and figure out details from expert opinion in fields like toxicology before we sort of draw any conclusions from a health perspective.
So nothing definitive. Are you making any preparations, though, for a range of options from a health perspective, Dr. Sheffield?
Yeah, I think, it's kind of been business as normal from a hospital perspective in many ways right now, particularly from the pediatric department. And I think once we find more information, and hear from experts, we'd be then, be ready to act accordingly if need be.
Okay. Then why don't we say, I'll speak to you again soon, potentially, about this, because the results officially expected back within days. I really appreciate the information this morning. Dr. Sheffield, thank you for the time.
Thank you so much. Take care.